Hello, my name is Tanisha Avon, and today I'm going to talk to you about breast cancer risk and prevention. What better topic to discuss during Breast Cancer Awareness Month? Okay, today we're going to discuss breast cancer rates in the US and South Florida, identify what is breast cancer. We're going to talk about the signs and symptoms, and also identify lifestyle related risk factors and also risk factors you cannot change. Okay, so let's dive in. The American Cancer Society's estimates for breast cancer in the United States for 2020 are, these are current year estimates, approximately 276,000 new cases of invasive breast cancer will be diagnosed in women, about 48,500 new cases of non-invasive cancers, and this is cancer in the earliest form, will be diagnosed. About 42,000 women will die from breast cancer. So as you can see, this is still a major problem. Now, when you look at the trends in death rates, breast cancer is the second leading cause of cancer death in women. And this is also seen in Miami-Dade and Indian River counties, which is here in South Florida, which is we'll talk about on the next slide. Now, since 2007, breast cancer death rates have been steady in women younger than 50, but have continued to decrease in older women. Okay, so let's talk about what is breast cancer. So breast cancer starts when cells begin to grow out of control. Breast cancer cells usually form a tumor that can often be seen on an X-ray or felt as a lump. Most breast lumps are benign and not cancer, which also means malignant. That's a term you'll hear frequently. Now, non-cancerous breast tumors are abnormal growths, but do not spread outside the breast. They are not life-threatening, but some types are benign breast lumps and can increase a woman's risk of getting breast cancer. That's very important to know. Now, any breast lump or change needs to be checked by your healthcare professional to determine if it's benign or malignant, and if it might affect your future cancer risk. So that's very important. If you feel anything abnormal, please make sure you reach out to your healthcare professional. Now let's discuss where does breast cancer start? Now, most breast cancers begin in the nipple. Well, first, let's discuss about the breast. So let's see, as you can see in the photo, each breast contains 15 to 20 lobes of glandular tissue arranged like petals of a daisy. Now, the lobes are further divided into smaller lobules that produce milk for breastfeeding. And then small tubes called ducts conduct the milk to the reservoir that lies just beneath your nipple. Most breast cancers begin in the ducts that carry milk to the nipple, which are called ductal cancers, and some start in the glands that make up breast milk, called lobular cancers. Okay, so there are different types. Okay, now let's discuss the signs and the symptoms. Now, first and foremost, I want to say, knowing how your breasts normally look and feel is an important part of breast health. Although having regular screening tests for breast cancer is important, mammograms do not find every breast cancer. This means it's also important for you to be aware of the changes in your breast and know the signs and symptoms of breast cancer. As you can see in the picture, there are different signs and symptoms. The smaller picture shows the crusting of the areola or the nipple area, and the larger picture shows the inversion, which means dimpling, so your nipple sinks in. Okay, so a breast lump or thickening that feels different from the surrounding tissue, change in the size, shape, or appearance of a breast, changes to the skin over the breast, such as dimpling, as you can see in the picture, peeling, scaling, crusting, or flaking of the pigmented area of skin surrounding the nipple, the areola, redness or pitting of the skin over your breast, like the skin of an orange. So these are all signs and symptoms that you want to be aware of, okay? If you see any of these signs or symptoms, it's important to make an appointment with your doctor if you notice anything unusual, and please make sure you make that appointment as soon as possible. Don't wait. Okay, so let's discuss how breast cancer spreads. Okay, now breast cancer can spread when the cells get into the blood or the lymph system and is carried to other parts of the body. Now, the lymph vessels carry lymph fluid away from the breast. Now, the lymph system is a network of lymphatic vessels found throughout the body that connect the lymph nodes. They're very, very small, small bean-shaped collections of your immune system cells. Okay. Now, the fluid inside these vessels contain the tissue byproducts and waste materials as immune system cells. And the cancer cells can enter those lymph vessels and start to grow in lymph nodes. Now, this is very important because if the cancer cells have spread to your lymph nodes, there's a higher chance that the cells could have traveled through the lymph system and spread, or another term is metastasized, to other parts of your body. So the more lymph nodes with breast cancer cells, the more likely it is that the cancer may be found in other organs. So again, going back, if you see any signs or symptoms, you want to speak to your healthcare professional as soon as possible, because we want to be aware of all of these factors. Okay, so let's discuss some lifestyle-related breast cancer risk factors. Okay, now, again, many breast cancers are also found on screening mammograms, which can detect cancers at an earlier stage, but often before they can be felt and before symptoms can occur. But we also have some lifestyle-related breast cancer risk factors that we want to dive into and discuss to reduce our risk of getting breast cancer. Okay, so a risk factor is anything that increases your chances of getting a disease, such as alcohol, being overweight or obese, not being physically active, not having children, not breastfeeding, taking birth control, and taking hormone replacement after menopause. So these are all lifestyle-related breast cancer risk factors that we can control. So number one, alcohol. So alcohol use is one of the most important preventable risk factors of cancer. The risk increases with the alcohol consumed. So let's see. We have alcohol use accounts for about 6% of all cancers and 4% of all cancer deaths in the US. Again, preventable. Drinking even small amounts of alcohol is linked with an increased risk of breast cancer in women. Alcohol can raise estrogen levels in the body, which may explain some of the increased risk. And we'll discuss more of estrogen later. Women who have one alcoholic drink a day have a small, about 7% to 10% increase in risk compared with non-drinkers while women who have 2 to 3 drinks a day, about 20% higher. So as you can see, the more alcohol you drink, the higher risk you have of getting breast cancer. So just be mindful of that. There is a link between alcohol and breast cancer. Okay, being overweight or obese. Now, being overweight or obese can have far-reaching health consequences. Including including raising your risk for certain types of cancer. Pre-menopause, ovaries make most of your estrogen, and fat tissue makes only a small part of that total, okay, during pre-menopause. Now, post-menopause, if you have more fat tissue after menopause, it can raise your estrogen levels and increase your chance of getting breast cancer, okay? So this is something very important to note for postmenopausal women. Women who are overweight tend to have a higher blood insulin level, and higher insulin levels have been linked to some cancers, including breast cancer. Okay, so this is very, very, very important. Okay, let's talk about lack of physical activity. Regular physical activity reduces breast cancer risk, especially in women past menopause, postmenopausal women. Okay, recommend adults. It is recommended that adults get 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity activity each week, or you can combine them, of course. Now, Getting to or going over the upper limit of 300 minutes is ideal, but everyone has a starting point, right? So we want to make sure we're staying active, especially during these times. A lot of us have been staying home during the pandemic, so we have been outside of our normal routine. So we want to make sure that we're staying active and being healthy. Okay, let's discuss about not having children. So women who have had their first child after the age of 30 have a slightly higher breast cancer risk overall. Women who have never been pregnant have a greater risk of breast cancer than do women who have had one or more pregnancies. So it's just important to just be mindful that not having children can increase your risk of developing breast cancer. Also, not breastfeeding. If you do have children, or infants, young children, not breastfeeding may slightly lower your risk of cancer, especially if it's continued for a year or more. Now, the explanation behind this is that breastfeeding reduces a woman's total number of lifetime menstrual cycles. So again, this is going back to the estrogen, okay? Breastfeeding, again, reduces a woman's total number of lifetime menstrual cycles. And we have seen that it's linked to estrogen, and estrogen has been shown, elevated levels of estrogen has been shown to increase your risk of breast cancer. Okay. Also, birth control. Now, let's talk about oral contraceptives. Most studies have found that women using oral contraceptives, birth control pills, have a slightly higher risk of breast cancer than women who have never used them. Birth control shots, also known as Depo-Provera, is an injectable form of progesterone that's given once every 3 months for birth control. And then they also have birth control implants, IUDs, skin patches, or vaginal rings. These are other options. These forms of birth control also use hormones, which in theory could fuel breast cancer growth due to the hormones that are utilized with these methods. Now, going back to the oral contraceptives, once the pills are stopped, this risk seems to go back to normal within about 10 years. So after 10 years after stopping the oral contraceptive, your risk of developing breast cancer can go down. Now, some studies have found that women currently using the birth control shot, the Depo-Provera, these shots seem to have increased in breast cancer risk, but other studies have not shown that increased risk. So the research is still being done regarding the Depo-Provera, the birth control shot. Now, as far as the IUDs, the skin patches, the vaginal rings, some studies have shown a link between the use of hormone-releasing IUDs and breast cancer risk. But few studies have looked at the use of birth control implants and patches. So the research is still being conducted on that. But the research is very clear regarding oral contraceptive, which is the birth control pills, that you have a slightly higher risk of breast cancer. However, once you stop taking the oral contraceptive, 10 years later, your risk of breast cancer will go down. It will take some time, but it will go down. Okay, let's discuss hormone replacement after menopause. Postmenopausal hormone therapy. Now, the risk of breast cancer decreases when women stop taking these medicines. However, women who take hormone therapy medications that combine estrogen and progesterone to treat the signs and symptoms of menopause have an increased risk of breast cancer. But again, the risk of breast cancer decreases when women stop taking these medications. Breast cancer risk factors you cannot change, okay? And now this is important because this is some things that you don't have control over, but there are still things that you can do to try to decrease your risk. So of the breast cancer risk of factors that you cannot change, such as being born female and getting older, others are inheriting certain gene changes from your parents, family history of breast cancer, personal history of breast cancer, race and ethnicity, if someone has dense breast tissue, and also going through menopause after age 55. Okay, so let's talk about the gene inheritance. Okay, so about 5 to 10% of breast cancer cases result from hereditary genes, meaning that the results directly from gene changes or mutations passed on from a parent. So these is, again, something you cannot control. This is something that was passed on from your parent. Now, the most common cause of hereditary breast cancers is the inherited mutation of these two genes you see here, BRCA1 and BRCA2. If you have inherited a mutated copy of either of these genes from your parents, you have a higher risk of breast cancer. Now, mutated versions of these genes can lead to abnormal cell growth, which can lead to cancer. A woman with both of these, either gene, has up to a 30% chance of getting breast cancer by the age of 80. So it's a pretty high percent chance. Women with one of these mutations are likely to be diagnosed with breast cancer at a younger age, as well as to have the cancer in both breasts. Okay, and this is something definitely want to consider if maybe you know you have a family history. So the risk is also affected by how many other relatives or family members have had breast cancer. It goes up if more family members are affected. Okay. Again, let's talk a little more about the family history. So most women who get breast cancer do not have a family history of the disease. However, about 15% of women with breast cancer have a family member with the disease. Now, women who have a close blood relatives with breast cancer have a higher risk of developing the disease. However, having a first-degree relative, mother, sister, or daughter with breast cancer almost doubles a woman's risk. So if you have a very close relative, mother, sister, or daughter, it doubles your risk. Having two first-degree relatives increases her risk about threefold, and women with a father or brother who has had breast cancer also have a higher risk of breast cancer. So again, it's a family history and it has to do with the genes. So male or female, it doesn't matter. As long as you had a family history of breast cancer, then your chances increase of developing. So this is something you just want to look into if you have a family history. What about if you have a personal history? So a woman with cancer in one breast has a higher risk of developing a new cancer in the other breast or in another part of the same breast. This is different from a recurrence or a return of the first cancer, okay? This is very different. Although this risk is low overall, it's even higher for younger women with breast cancer. So again, looking at your family history, looking at your personal history of breast cancer, all these play a factor. Now, let's look at race and ethnicity. Okay, so white women are slightly more likely to develop breast cancer than African American women. Breast cancer is more common in African American women. African American women are also more likely to die from breast cancer at any age. So this is important to know. Although white women are slightly more likely to develop breast cancer than African American women are more likely to die from breast cancer at any age. So that, again, that's that racial disparity. Asian, Hispanic, or Native American women have a lower risk of developing and dying from breast cancer. So again, please just make sure you know your risk. Okay, now again, this is one of those other things that you cannot control. If someone has dense breast tissue can also make it harder to see cancers on mammograms. So there are a number of different factors, but breasts are made up of fatty tissue, fibrous tissue, and glandular tissue. Breasts appear denser on mammograms when they have more glandular and fibrous tissue and less fatty tissue. So again, dense breasts can make it difficult to to see cancers on mammograms. Women with dense breasts on mammograms have a risk of breast cancer that is about 1.5 to 2 times that of women with average breast density. So, of course, this is something that we want to be mindful of. A number of factors that can affect breast density is such as age, menopausal status, and the use of certain drugs, including menopausal hormone therapy, pregnancy, and genetics. These are all factors that can affect your breast tissue, and how dense your breast tissue is. Okay, menopause after age 55. Women who have had more menstrual cycles because they went through menopause later after the age of 55 have a slightly higher risk of breast cancer. Also, the increase in risk may be because they have longer lifetime exposure to hormones, estrogen and progesterone. And again, remember we said earlier the estrogen has been linked to increased levels of estrogen has been linked to increased risk of developing breast cancer. Okay, so it's something you want to discuss with your healthcare provider. If you are postmenopausal, your hormone therapy and the different hormones that you are using during your treatment is something you definitely want to discuss with your physician to see what is going to be best for you. Okay, now how can I lower my risk of breast cancer? Okay, let's see. We can get to and stay at a healthy weight. Both increased body weight and weight gain as an adult are linked with a higher risk of breast cancer after menopause. So we want to get to and maintain that healthy weight. Be physically active. Again, many studies have shown that moderate to vigorous physical activity is linked with lower breast cancer risk. So again, it's important to get that 150 to 300 minutes a week of physical exercise, or the 75 to 150 minutes a week of vigorous physical activity. Okay. Avoid or limit alcohol. Like we discussed before, alcohol has been seen to increase estrogen levels. Estrogen has also been linked to increased risk of developing breast cancer. Now, alcohol increases the risk of breast cancer. Even low alcohol levels intake have been linked with the increase of risk. It is best not to drink alcohol at all, but for women who drink, they should have no more than one alcoholic drink a day, which can be a drink of 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof distilled spirits, or other known as hard liquor. Okay. Now, women who choose to breastfeed for at least several months may also get an added benefit of reducing their risk of breast cancer. And again, this is going back to those estrogen levels. Okay. Women who breastfeed longer they have less menstrual cycles, meaning they have less estrogen being produced. So the less estrogen you have, it decreases your risk of developing breast cancer. And again, for those postmenopausal women, you may want to discuss with your physician regarding non-hormonal options to treat your menopausal symptoms. Okay, now for women at increased risk of breast cancer, these are some other options you may want to look into. Okay, genetic counseling and testing for breast cancer risk, close observation to look for early signs of breast cancer, medicines to lower breast cancer risk, preventative prophylactic surgery. Okay, now we're going to discuss these. Okay, if you are a woman at increased risk for breast cancer, for instance, if you have a strong family history, or you know that you have the gene mutation that increases breast cancer risk, the two that we discussed earlier, the BRCA1 or BRCA2, there are some things you can do that might help lower your chances of developing cancer. But you also want to be sure to you know, your healthcare provider can help you determine your risk of breast cancer as well as which of these options might be right for you. So please make sure if you are a woman or man at increased risk of developing breast cancer, here are some options, and please just make sure you discuss them with your healthcare professional. Now, close observation. Okay, let's see. For women at increased breast cancer risk who don't want to take medicines or have surgery, some doctors might recommend close observation. More frequent doctor visits, such as every 6 to 12 months for breast exams and ongoing risk assessments. Starting breast cancer screening with yearly mammograms at an earlier age before the recommended age, and possibly adding another screening test such as a breast MRI. Now, while this approach doesn't lower breast cancer risk, it might help find it early when it's likely to be easier to treat. This is the overall goal. We want to find the breast cancer early as possible so it's easier to treat, okay? Early stage diagnosis, not late stage diagnosis. Okay, now they do have some medicines to lower breast cancer risk. Medicines such as tamoxifen and raloxifene block the action of estrogen. Again, estrogen, going back to that, estrogen in breast tissue. Okay, prescription medicines can be used to help lower breast cancer risk in certain women at an increased risk of breast cancer, such as, again, tamoxifen and raloxifene. Now, tamoxifen might be an option even if you haven't gone through menopause, while raloxifene is only used for women who have gone through menopause. So again, discuss with your healthcare professional to determine which option is going to be best for your situation. Now, aromatase inhibitors may also be an option for postmenopausal women. So again, whether you're premenopausal or postmenopausal, you have these different options, but please make sure you consult your physician first. Okay. Also, preventative surgery for women with very high breast cancer risk. You have different options here. You have surgery to remove the breast or the ovaries, which is called a prophylactic mastectomy or prophylactic operectomy. Okay. Now, while surgery can lower the risk of breast cancer, it can't eliminate it completely, and it can have its own side effects. So again, consulting your physician which option is best for you is going to be extremely important. Prophylactic mastectomy. Now, women who have very high risk for breast cancer, such as from the BRCA gene mutation, may consider this. This can lower your risk by 90% or more. It doesn't guarantee that the surgery will get all of the breast cancer, but it will significantly lower your risk of developing breast cancer later on. While prophylactic mastectomy can lower your risk by 90% or more, again, it does not guarantee that you will not get breast cancer, but it will significantly lower your risk. Now, the prophylactic operectomy is the removal of the ovaries, which are the main source of estrogen in the body. Again, if you are a woman at very high risk of breast cancer, this option may be appealing to you. Again, due to the ovaries, which is the main source of estrogen, and again, the increased levels of estrogen have been linked to increased risk of breast cancer. So consult your physician to see which options are going to be best for you if you are a woman with very high breast cancer risk. Again, all of the options presented today are for pure educational purposes. Again, please consult your healthcare provider or physician regarding your options and ways to move forward to continue to reduce your risk of developing breast cancer. Thank you very much for taking the time to spend time to listen to our presentation today. We most appreciate your time. And if you have further questions or comments, please contact me at Tanisha j.avent1@gmail.com. Please have a wonderful day, and I hope you be well.